Welcome back to the Students of One Health podcast. I'm Sebastian. We're interviewing Dr. Amy Land here today. Dr. Amy Land, you have a lot of experience in shelter medicine specifically, a lot of general practice experience as well. So we just want to hear a little bit more about that today. Firstly, how did you end up in veterinary medicine? How did you know that was for you?
I think that was kind of a typical story. Grew up wanting to help animals when I was a kid, and also was interested in English teaching, like being an English teacher or being a writer. And those two loves just sort of stuck with me for a long time. I actually was an English major in college, and I actually studied writing. So I graduated with a writing degree, taught English in Japan for a year, but I still love veterinary medicine, and I'd been doing a lot of work as a kennel staff and vet tech or assistant anyway. So it was just a love that sort of stayed with me. So I ended up going back around, did my pre-vets actually at CSUN in my 20s. So I went to vet school later in my late 20s. Yeah.
All right. Well, following your passion. That's very cool. Okay. I know shelter medicine has such a diverse meaning to a lot of different people in veterinary medicine. What does it mean to you?
So, I was thinking about that, and I think shelter plays a really interesting role. I think one of the things I love about it, which is sad but also rewarding, is that we really are like the last stop. I feel like ideally our patients go to specialists, and when they can't go to specialists, they're at general practitioner, and when the general practitioner can't deal with something, then they end up at the shelter. And we really are kind of the last stop before euthanasia or languishing and suffering in someone's yard. Right. So I think it's a really great opportunity to help animals that have no one else to help them. Like we really are the last chance for them. And that's kind of a special place to be.
Wow. Yeah, that's a very important way to think about it. I wanted to ask too, I don't have a lot of experience in shelter medicine. What does a typical day look like for you?
So for me, my shelter that I've been at, I was at SPCA for LA for 5 years. And then the last 5 years I've been at Los Angeles. I've been overseeing a population by myself, just one vet. Usually there's just one vet per shelter. And some shelters have multiple. I had about 100 to 200 dogs, about that many cats, and more exotics on top of that. Okay. Interestingly, my shelter was the only one in Los Angeles that saw large animals. We had a barn. So we had horses, potbelly pigs, sheep, goats come in sometimes. We had a donkey. So we had 40 sheep come in one time.
That sounds pretty complicated.
So a typical day would be I'd come in. I'm the only vet, so on the days off, my technicians would have had animals come in that were sick and had problems. They would follow protocols I've written and have started meds for animals, and then they would put them on vet checks. So I would be coming in, I'd be doing my vet checks. I also had to do the schedule and, supervisory stuff, emails. And then my techs in the morning would be doing intakes. So every day we have a list of intakes, animals that need to be, they would get a tech exam, vaccines, deworming, flea control. So, and then meanwhile, animals are getting adopted and redeemed by their owners. So we've got animals going in and out, and then I'm doing my vet checks, and then I'm also trying to squeeze in surgeries, procedures, sedation, x-rays, whatever else needs to be done. It's kind of a free flow. I actually like having a lot of control of my schedule. I can triage it. I love not having appointments because appointments are kind of rigid, and it's sort of stressful that you have to stay. Shelter's totally stressful. We have tons to do, but at least I have some discretion over when to spend my time on what. So that's really nice. I do have a lot of independence that way, and so I'm able to just kind of triage and never get my work done at the end of the day. That was one nice thing about private practice. I could actually feel like I finished. But so typically I'm just shoving things to the next day, but I deal with things in order of importance. So.
Okay, that's pretty cool to have that sort of independence. Do you feel like you have the appropriate amount of support staff to help you with that?
You're funny.
Okay.
So for my, about 400 animals, I had 5 techs, sometimes 4.
Okay.
But I'm going now to South Central, which has almost 600 dogs right now, and about that many other animals. And I'm going to have 5 techs. and that's to cover 7 days a week with a swing shift.
Wow. Okay.
So no,
Sounding a little
super short staffed, which unfortunately does contribute to some real burnout and low morale. Unfortunately, I think that's pretty common in shelter.
Okay.
On the downside, but yeah.
Okay. Yeah, I hear a lot about that being one of the biggest issues with shelter medicine these days is burnout.
And just shortage of resources.
Right.
Not having enough staff, not having enough resources to provide the care that you want to be able to provide, and sometimes even to provide the level of care they need. It is saddening. Like it's a burden to feel emotionally like you just can't keep up with what's needed. My boss pointed out that people understand this concept a little better after COVID because this term capacity to care really got explained to the general public.
Right.
And we are just so far past our capacity to care, at least in my shelter system. And yeah, that is causing burnout, just like it did on the human doctors and the human nurses and the human hospitals during COVID. So I think people can really understand and relate to that now.
Okay. Wow. Do you feel like, I know shelter medicine, you're often at the forefront of a lot of the public health parts of veterinary medicine. Do you feel like you have a lot of experience in that area?
Yeah, I have learned a lot, and it is an interesting part of the role of shelter medicine. We really are in between general practitioners, the public, and the animals in terms of a lot of these issues. So we are integral in enforcing, for example, rabies vaccination. I mean, and vaccinations in general, are really supported and pretty much required, by the shelters. Any animal that gets lost and ends up with us will get vaccinated before it gets returned.
Right.
Puppies and any animal that's coming in between homes, to the shelters getting vaccinated. We're obviously legally requiring rabies vaccination, and we're enforcing that with officers. So that has been a really important part of eradicating rabies, which is something we take for granted, I think, in the U.S., but it's still a major issue in Nepal and other. Sorry, my cat.
Oh, that's all right.
My apologies.
She's very cute.
She's a little shelter cat, by the way. So, we've been part of controlling rabies. This is not quite public health, but I was thinking to mention like some of the interesting things we do. For example, we are a fallout for the fires. So when the fires swept through, we had hundreds of animals come in. An entire guinea pig rescue was evacuated. And also because I see horses, we actually had to put them at Hanson Dam, but a lot of the shelter workers went over. We had probably 20 or 30 horses that were evacuated to us. And then we had several hundred, the guinea pigs, and then also animals, dogs and cats. Right. People that were evacuated from their homes were able to take them to the shelters. So I think, we are able to serve a lot of serve an important role in supporting the community. We are getting a lot of wildlife. So typically if someone finds a dead wildlife, it will come through us. So we work closely with public health on monitoring, like when Newcastle was an issue, we're doing West Nile, we're submitting our crows and ravens. We now highly, the HPAA, AI, so highly pathogenic avian influenza. We are now part of working with public health on submitting samples for that and monitoring for that. We've also done a lot of COVID testing. I think I showed you an article.
Yeah.
So we've helped with public health has been coming in COVID testing our exotics, our pocket pets, because they have found some COVID positive animals and they're doing studies with that. So we do partner with public health a lot. And I mean, obviously we're doing rabies quarantine. So a lot of our public health interactions are rabies quarantine and bats. We have a lot of rabies in our bat population. So most of our rabies positive are bats. But, like we had this family who found a bat and their child made it their pet and the parents knew about it and the child slept with the bat in bed. And then the bat eventually bit the child, I think is why they ended up bringing it to the shelter. And then they were upset that we might be euthanizing their child's pet. And we were trying to explain to them that, your child slept with an animal that is very highly, high chance it has rabies. It did not, thankfully, but so a lot of interesting stuff like that. And we are really closely working with public health. Also, for example, I'm sorry, I had a CIV outbreak at my shelter.
Uh-huh.
So my shelter was the first with canine influenza virus. It
Wow.
actually swept through my shelter. It was pretty dramatic, kind of horrifying for me, but these
Scary.
things happen. Yeah. So
Yeah.
like, I think we had like 3 dogs that were coughing on Wednesday. By Saturday, we had like 20, and by the following Wednesday, all but two, so 100 out of 102 dogs were sick, and
Okay.
it just ripped through.
Yeah.
And public health actually came in. They shut down my shelter for a month.
Hmm.
No ins, no outs for dogs anyway. We actually partnered with a veterinary school back east. I don't remember which one, maybe Wisconsin. And they were great in funding, helping. They sent us tests. So we were actually tracking clinical signs with these huge spreadsheets of all 100, actually all 102 dogs for a month. And we were swabbing, doing nasal swabs. So we tracked the disease process, how many animals, the outcome of the animals, how many died, how many were euthanized. Two, by the way. Everybody else survived.
Okay.
So,
That's
and
pretty
most of
good.
them didn't get very sick. I actually thought I would have a lot more casualties than that.
Right.
And the two that passed away had other issues, complicating issues. So, really just made the dogs a lot of morbidity and low mortality.
Right.
But anyway, it was really interesting to work with the vet schools and be part of a study and work with public health on that. And then obviously interfacing with the public and educating the public about it because everyone was freaking out. Oh my gosh, the shelter has this, major disease all through it. So it's really actually very interesting stuff as a veterinarian to be part of that.
Hmm. Wow. That sounds like a very like efficient response on the part of both, the government and the shelter
Yeah.
system too.
Yeah,
So
it was a really good response, and
sounds pretty
we
cool.
controlled it, and all the dogs got through it, and yeah, it went well. I was glad that they closed the shelter though, because at the time I was doing research and talking to people, and I guess a lot of shelters don't elect to close. So props to LA for that, because other shelters that didn't close and were trying to just contain it, apparently it can perpetuate for years in their population because they're not stopping the ins and outs.
Mm-hmm.
So that was a really good choice on their part. But again, it comes to interesting decisions on the part of public health and also, the government, the powers that be controlling the shelter in terms of decisions of how to handle these disease outbreaks and such.
Right. Okay. Do you feel, I mean, a lot of new grads coming out of school, they're obviously very concerned with finding mentorship, getting experience, and finding a place that's comfortable for them to practice, not pushing them to do too much. Do you feel like you can start out in shelter med as a new grad, or would you recommend people pursue
Absolutely
GP?
not.
Absolutely not. Okay.
I wanted to actually. I was kind of interested, but no, it's a really bad place for a new grad, I would say.
Okay.
You need to learn to walk right before you run. You are so limited in shelter. I think it's really critical that you just get comfortable practicing medicine, but also you need to learn what things look like when you have the proper diagnostics and when you have the proper medications and choices. And you can partner with specialists, because in GP you're able to learn from specialists. You're able to send things and then they'll say, hey, to better manage this disease, I'm going to tweak the medications this way and maybe try adding this, or I did this further diagnostics. So you really have the benefit of being collaborative. Also, in a general practice, you're probably working with other vets. I was glad I didn't do an internship because I was older when I graduated, but I was glad I did a year of emergency at an 18-doctor practice. So I really got to see a lot of things that year. I got a lot of experience. And then I did about 5 years, maybe, general practice before I went into shelter. And it's really important because now, once I've gone into shelter, I mean, we have medications, but we're very limited. And we have x-ray at my shelter. At SPCA, we didn't even have that. So we'd have to send an animal out to shelter. So I really got good at my physical exam because I'm not proud to admit this, but in private practice, we'd have a limping animal and I'd be like, we need x-rays, it's like, but in shelter, I'm like, they'd be, hey, do you really think it's broken? Do you really think it's worth, because when we got to arrange transport and pay, and I'd be sitting there really tweaking a leg, really fiddling with it, trying to figure it out, because we didn't have x-ray. We couldn't just jump to, hey, let's run some blood work. Hey, let's do some x-rays. My current shelter, I don't have blood work and I don't have bells and whistles with treatments and at all. You really have to kind of be inventive. I always feel like I'm kind of in a war zone. I really like that show MASH from the 70s and 80s,
Okay.
as I often
You
feel
compare.
like that.
Okay.
Because like they'll will run out of things. There's a MASH episode where they run out of penicillin, and it's
Uh-huh.
like, you know, it's just you're suddenly like, oh my gosh, okay, what do I do? What do I do in this situation without these things? So that's
Mhm.
why I think it's important for new grads to learn the proper way to do things when they have
Right.
all of the resources before they get those resources stripped away from them, and
Okay.
then have to be inventive
Yeah. Basically, just building up your toolbox before. All
before
right.
you're stripped of it.
All right. Okay. Yeah. I mean, what advice would you give veterinary students, just like in general in vet school, aspiring students who want to go into shelter med? Is there anything that they should look towards doing in school, out of school, other than internships, that sort of thing?
um, I think I think just being open minded in general, and
Mm-hmm.
this isn't shelter specific, but I think get as many experiences as you can with everything, because veterinary medicine is so diverse,
Mm-hmm.
and a lot of people really think they know what they want, and they do want that, but then after 10 or 15 years or 5 years, maybe you're bored of that, or maybe
Okay.
actually it's not quite what you thought. I never had a thought to do anything other than general practice. I was a little interested in like mixed animal and exotic, which I do enjoy and have done that some, um, but I never thought of shelter. However, I did seek out a lot of experience with, I had an optional large animal surgery I got to do, and I did a lot of work with our wildlife group, and I did a lot of work with large animal and ambulatory, and those skills and those experiences actually have been really helpful in shelter,
Mm-hmm.
because we do get a lot of wildlife, and we
Right.
do get it. I ended up seeing large animals, and I just never expected that. So I think broadening your horizons and just exposing yourself to as many different areas of veterinary medicine as you can. Maybe you reflect on those later and actually use some of what you learned, or anyway, it helps you to just kind of know what's out there.
Right. Okay. All right. Do you have a particular medical case that would be your favorite?
Oh, yes. So I was trying to think about that. Well, one of them is my little black kitty who just ran through and interrupted our
Somewhere
filming.
around here.
She came in kind of little tiny kitten, and she was pretty munched up in the back end, assumed hit by car, degloving injury to the tail. But actually, the skin around the base of her tail was torn off as
Right.
well. So I
Okay.
really didn't think I was going to be able to close that. But then my kennel staff that I was working with gave me sad eyes, and the kitten gave me sad eyes, and I was like, okay, let's try. So I was able to close her up, even though I
Mm-hmm.
was stretching there. She didn't walk for months. Started using one leg pretty quickly, but the other one dragged for, gosh, 3-4 months. Now she
Okay.
runs around like a wild woman.
She
She's
seems great
totally
now.
fine.
I mean,
Yeah,
yeah.
she's got like mild CV deficits, a little bit of ataxia back there, but really great quality of life. So that was a really good story, and I think a lot of things like that are a testament to what animals can survive. I think in shelter in general, it's incredible what animals can survive.
Mm-hmm.
Sometimes it's sad to have to euthanize something that has already survived so much, but I do have to. But other times I can save animals, and it's pretty incredible. Like one of my very rewarding cases was a kitten, 1.2 pound kitten that came in with both eyes crusted, dry, dead. They were proptosed,
Mm-hmm.
probably, I think, severe URI as a kitten,
Okay.
maybe when her lids were still closed, because she was still very little. And
Mm-hmm.
her eyes, she was so painful. She had the feline grimace, if you know what I'm talking about.
Yeah.
She was just totally shut down. And I did a bilateral enucleation on her. Actually talked to an anesthesiologist before doing that, because I knew it was going to be a long procedure, and she was tiny. She did great, and she was so happy. She was playing, bouncing off the walls the
Mm-hmm.
next day. I mean, so fast.
Wow.
Had another kitten come in. That's my smallest surgery yet. He was so 0.8 pounds.
Oh my gosh.
Yeah, a little
That's so
black and white.
small.
And he came in. Of course, he came in at like 5 o'clock on Saturday, which was my Friday, and it was
Right.
seriously like 4:50. And he, kennel staff dropped him off in our room, medical, and then they left. And I see this little thing crying, or
Medical.
yeah,
Yeah.
medical. And then I see this little thing, meow, meow, meow. It was climbing and trying to get out and eating. And I saw him from
Yeah.
afar, and I'm like, okay, what is this thing? And came over there. distal part of his leg is just missing,
Oh my gosh.
dry bone sticking out, dead bone, and just really bad maggot infestation.
Wow.
Yeah, and I was like, well, yeah, I mean, it's a lot of times, unfortunately, cases like that we do have to euthanize just because we don't have the manpower and the
Hmm.
time, and there isn't another vet if that came in on a day I wasn't there. Um, and I was actually about to be off, but I asked one of my techs, who's a sucker as well for cats, and I'm like, "Do you want to stay OT? It probably won't make it, but we'll try."
Right.
So she stayed. We did the amputation. It was so tiny. I've actually worked on rats that were substantially larger than that kitten, but
Okay.
I amputated the leg. I mean, tying off his femoral artery was like
Yeah.
so tiny. But he did great. He
Oh
was
my
like
god.
running around the next day. I mean, he'd been running around before, amazingly.
Hmm.
And I had another cat that came in right at that time, female, probably a year old, young, white cat, with like literally her entire uterus hanging out, like the whole thing.
Yeah.
What's amazing is once I went in surgically, her suspensories were still intact. So her
Okay.
ovaries were
That
like
was
stretched
all that
all the
was.
way down. Like, I was like, how are these not ripped? And she was bright alert,
Hmm.
eating, yelling, and I'm looking at this thing that's dried and dead hanging out of her, and I
Yeah.
was like, okay, do I euthanize? Do I try? And that's the cool thing about shelter too. It's like it's up to me, what I think I can handle, what I think I can take on.
Hmm.
I mean, to some degree. To some degree, it's not because I'm too limited by staffing shortage and things
Right.
like that. But I tried it out, and I was able, with two of my techs helping to kind of squish things in from the outside, and I got her whole uterus reduced and removed, and she
Wow.
did great. And stuff like that is really cool. And
Uh-huh.
I really enjoy surgery, so a lot of like surgical challenges we had. I've
Hmm.
had two uh, lip and chin avulsion cases. I think I showed you pictures of
Yeah.
one cat. I had an Australian Shepherd that was beat up by the owner's other dogs,
Hmm.
and they tore all the skin and tissue down
Wow.
off of his jaw. And that was kind of alarming because I'm like, I don't even know if I can fix this.
Right.
There wasn't even really much to attach it to. But I just gave it a shot and actually went really well with him and I had a cat with the same symptoms, and both animals did really well. And it's really cool stuff like that we get to see all the time in the shelter, because the numbers, right? You just have
Hmm.
so many animals coming through. You see all kinds of crazy stuff, hermaphrodites and things that you just aren't probably going to see in general practice for maybe one in your career, but for
Right.
us, we just see so much.
Wow.
So I think it really gives you a lot of opportunities. And there are other things about shelter, we didn't talk about, but like forensics and cruelty cases. And I've had to learn a lot about forensics, aging wounds by maggot size, and, just all kinds of stuff that you have to learn for writing these cruelty reports. And it
Hmm.
really is a diverse area of medicine, and it really is fascinating. I wish people would give us a little more credit. I mean,
Yeah.
if I could say one thing to the public and to the vets, it would be, please try to expect the best rather than the worst, because I do
Right.
think people unfortunately don't give us the benefit of the doubt.
Hmm.
Things get said online, people assume the worst and assume these bad things are true when they're not. My coworkers are lovely people. They love animals. Maybe in years past, many years ago, people got into shelter because it was a city job, had good benefits and a pension, like working at the post office or for Caltrans. But
Hmm.
now it's such a loaded thing politically and emotionally. I don't know anybody who gets into shelter without being really passionate about animals. And all of my coworkers, with a very few exceptions, were truly animal loving people who were kind and gentle and
Hmm.
good. And I just wish people knew that. And I wish that general practitioners knew that shelter vets are, we are strong vets. This is not like a job you end up at because you couldn't hack it in other
Right.
areas of
Yeah.
medicine. I've heard that said to me.
Really?
Yes.
People have said that.
Yes. A
Wow.
manager once said that when I was looking at going into shelter from
That's
private
horrible.
practice. He said, if you take this job, no one will hire you again. I know I would never hire someone who'd worked in a shelter because I'd assume that they had totally washed out and couldn't be employed
Wow.
at any general practice. Now, that was a really old school mindset, but I was very upset to hear that. And that was
Yeah.
right at the point in my career when I was thinking about going into shelter. And I was sitting there thinking, am I going to like ruin my resume? Am I going to make myself unemployable?
Oh my
Going,
gosh.
I know. Um, And the answer is totally no, by the way. I have
Right.
amazing skills, and it has given me really, really helpful perspective.
Hmm.
Even just lately, I've been going back and taking up some more private practice work, and I'm surprised how much help my shelter has been for general practice because of so many things I've seen,
Hmm.
so many cases, and just having a greater understanding about some issues that it's really opens your horizon in a way that being in more of a bubble, like a private practice bubble, you don't get exposure to those things. So
Hmm. Okay. Wow. Yeah. I mean, shelter medicine is very clearly like a very political, you know, field of vet med to the public and even internally. But it's amazing like what shelter vets can do.
yeah,
So I'm surprised it isn't given more of the respect that it deserves.
I should have.
It's
But he was, it's an old school thing to say, and
yeah.
I think things have. That's another thing I wanted to mention to you is that, for students that are thinking about shelter, just realize there's a huge variety out there. There's huge differences in different shelters right now. I think
Hmm.
20 years ago that was not the case. Like I think 20 years, 30 years ago, they were pretty much all high kill. I think it was more standard what you would find in shelters, but nowadays we've got no kill, low kill, we've got still high kill. So there's still
Right.
shelters where they're euthanizing perfectly healthy adoptable animals because they simply don't have the space. That is not my shelter. My shelter is nearly no kill, it's low kill. We aren't euthanizing things at all. So I think a lot of people incorrectly think, oh, shelter is going to be so depressing because they're going to be euthanizing everything. We're not at all.
Hmm.
In fact, we keep very dangerous dogs, and that is heartbreaking for us for different reasons. We adopt out these dangerous dogs, rescues
That's
pull these
hard.
dangerous
Yeah.
dogs. They have bitten multiple staff members, they have hurt and mauled staff members. It's really hard to see these animals actually not euthanized. I know that's a terrible thing to say,
But
but
I understand.
it's
Yeah.
actually going into shelter has been less euthanasia than I expected, and even in some cases feel is warranted
Hmm.
than rather than more. But again, that's because I'm in a very low kill shelter. A friend of mine is at a low kill shelter that has tremendous resources. Incredible. Like they can afford to send every critical case to emergency overnight. They have three
Wow.
doctors. They
Hmm.
have the money to send animals left and right to specialists. They've gotten chemo for cat with lymphoma. Um, they're sending animals to specialty and able to take the animals back from specialty and continue medications prescribed by the specialist. I mean, their resources are incredible. So I guess I would want students to know there are a lot of shelters out there, especially more and more now that people are thinking of animals differently and thinking of shelters differently. There's incredible resources. It doesn't necessarily limit your practice of medicine as much as you would think,
Hmm.
especially if, and it's not necessarily depressing at all if you're at a
Right.
low kill, no kill place that has good resources. It's actually a wonderful place because you're not having to think about money all day long. You're not having to talk estimates all day long, which is hard. And you don't have to interface with the public in appointments all day long. Though we
Hmm.
do have to interface with the public who are adopting and especially with the rescues. So there's still a lot of public interaction. It's just instead of clients, you're having that interaction with rescue
Right.
groups,
Other
adopters.
organizations.
Yes.
Yeah.
So don't think if you go into shelter, you're getting away from those awkward. A lot of people are
I
like,
guess
"Oh,
that
I
could be
don't
a
have to
common
deal with.
pitfall.
Yeah, I don't have to
Yeah.
deal with people anymore." Not true, unfortunately. But sorry, I shouldn't say unfortunately.
All right. Well, thank you for this interview. This was really eye-opening. Um,
Thanks for having me.
yeah,
Thanks
of
for asking. I'm
course.
glad to have a
It's so
chance
fun
to
to learn
talk to
about
it.
shelter med and like especially from someone who's so knowledgeable about it. So, thank you and thank you for having me here in this beautiful home.
Thanks.